Good afternoon, everyone, and welcome to the NEMT Foundation's presentation. I'm Rick Ellis, Program Chair for Paramedic Technology at a technical college in Macon, Georgia. Also on the Foundation board, and currently serve as a SWAT or tactical medic with our county SWAT team. So our thought topic today is active shooter hostile event in educational environments. You always see on the news the outside of it, but if you're inside and this is occurring, you want to know what's going on and how the responders are responding and what things you can do to help. So hopefully today we will cover some of those things and give you some background as to how things are occurring. Just recently, the FBI posted a study breaking down over the last 20 years, a review of all what they consider active shooter events. As you can see in the breakdown, education arenas cover number 2 on the list of priorities. That's including everything from elementary to institutes of higher education. So yeah, it's a target area on that setup. So as you can see within there are other areas there. You can probably look at some areas you may have also frequent to get an idea of the incidents in the last 20 years and things looking backward. Looking forward into a crystal ball, not sure what we could show going forward on this. But as you can see, we're looking at 18% there. Now, if we look closer down and drill down into our environment, the education environment, where I spend most of my time Monday through Friday, and you all do, we're looking at there were 62 incidents in the last 20 years. And you can see the breakdown of casualties. Out of the group, there were a number of shooters, the genders, predominantly male, and the age groups. So historically, within the educational environment, we're looking predominantly at teens as a setup, within the 20s setting up as the next area. So pretty much in your own environment with the age groups that we're looking at on that. If you're to look down further and look at how the casualties going back to that 419 through the market, if we broke them down by schools in age groups, as you can see here, the highest propensity is high school. And I'm making an assumption from everyone that I'm seeing on camera that you're all in the high school arena. I fall into the higher education arena here as an instructor, so we're number 2 in the setup. So the key factors, the takeaways on this for you all is to be vigilant. And we'll talk more about that later on in what the response is and what you can do as a setup on this. If you've got any questions during any time of any of this, drop it into the chat. I'll be more than happy to pull that up for you and answer those as a setup. So an ASHE, or as we talked in the beginning, an ASHE event is an active shooter hostile event, and the R in the ASHE stands for the response. Any ideas in the group how long an active shooter event really lasts? If you would, you can type that right into chat and give me some ideas of what your thoughts are. Okay, 15 minutes, 30 minutes. All right. Actually, an hour. Okay, we're getting on the high end of these. The actual event, believe it or not, all of the shooting is over 2/3 of the time before the police get there. And the police response time is usually between 3 to 7 minutes. So most of we call on our end, the killing or that part occurs within 7 minutes. So that is important for you guys to understand in the process. What you see on the news on the after effects is that's everyone going in, clearing the building, make sure everybody's okay, getting everybody out in the process. But the actual shooter event doesn't last that long as an average so far. So like we said, 70% of them last under 5 minutes. So they're done fairly quickly, unfortunately. 90% of them So the close there is 13 minutes on this. So once again, very, very quickly. How long do you think it takes somebody to bleed to death? And I'm going to throw that back into chat. If they've got a major bleed, they're flowing a lot of blood out, how long do you think it would take them to die? 3 minutes, 5 minutes, 10 minutes? What are your odds and guesses? All right. Do you say 5? 10? Okay. 5 to 10. Yeah. It looks like the 5's on the market. Yeah, actually, depending upon it, you're looking at anywhere at the 3 to 5 minute mark. So if we've just put everything else previously, it's vitally important if the police don't get there within 3 to 7 minutes, who's the important person to respond in this? Because EMS is going to take a little while to get there too on that. So unfortunately, like you said, the 3 to 5, 60% of all deaths occur in under 3 minutes as a rule. There have been exceptions to this, but it's like the Columbine. If you go all the way back to 1999, the Columbine shooting, the teacher there unfortunately died after an hour and a half. But if you have a major, major bleed, it's under 3 minutes. So the question for you and kind of the takeaway here is this comes from the military. The fate of the injured often lies in the hands of the one who provides the first care to the casualty. So if the police officers are arriving in 3 to 7 minutes, EMS is going to be shortly behind them. Who do you think the first person's going to be in your classroom? The answer is going to be you. So we need to take care of that as a process, and we'll get more into that. Now, like we said, the topic is the active shooter event and educational. The response. Prior to 2000, this previous procedure was in place. Firefighters would establish a medical triage area way away, not in danger. The police would go in, bypass the victim, get the shooter, and then bring the victim out to the cold area. And unfortunately, as you saw from the previous slide, that can take a while. So the killing was occurring in one of the most recent events that kind of changed the flow on this and integrated several different aspects to treat this type of event was the Sandy Hook. Set that up. After that, the Hartford consensus came out and they said that we need to do things a little bit differently and we need to get training a little lower into the mix. So after that new process that comes out, like I said, there's the cold zone. This picture is a little misnomer. It's off around the corner in no danger. The new way now to do it is that we call one of the methods is called a rescue task force, where you actually have police officers, fire, and EMS together, where they will go in and get the victim once the shooter has been either contained or taken care of in an area where the opportunity for gunfire is minimal, or at less, not a zero, but it's a less of a risk. Now, we talked the previous and the current one that law enforcement, if you've seen the videos, you've seen this stuff said, if you've seen law enforcement go in, they go in what's called a contact team or a rapid reaction team. Their focus is just what that is in quotes there. Their job and their mission is to stop the killing. An active shooter goes in with an intent to kill. He doesn't care who it is. As a general rule, he will kill. So their job is to go stop him. Now, if you're injured on the side, they are going to unfortunately bypass you, because if they stop and spend time to take care of you, he is still going down the hallway continuing his killing. So they have to make sure that that situation is taken care of as the contact team. So within the event that occurs, as you see on this map here, we have 3 zones that we use within EMS, fire, and police: hot, warm, and cold. In this case, the red is the hot zone, and that's telling us where the most likelihood of the most imminent danger is. And in this case, the diagram, the S is the shooter, and this 2 stars with CTs are the contact team. So in this situation, they've got him cornered into the corner of the building. The V's all represent victims. So as you can see, the next area would be the warm zone, not 100% clear, there's still a possibility something can occur. This is where EMS and fire in those those crosses that say RTF, which stands for Rescue Task Force, would go in and systematically treat, triage, and pull patients out to the blue oval, which is a CCP, which stands for a Casualty Collection Point. And then they would be transferred to the ambulances and to the treated to the hospitals in the appropriate order via triage processes. So you can see the zones in here, and you'll notice by these, there are no clear, in some cases, no clear pattern. It's not a perfect square. It's not a perfect circle. It's going to depend upon the building layout and how they can get to that. So that's the shooter, the warm zone. Let's talk a little bit about how the setup runs in. It's a good question came up. What is an ASHE again? It's an active shooter hostile event. They've added hostile into it because the aggressor no longer is using just a gun. We have seen instances where they've used vehicles, they've used explosives and other devices. So they are getting, unfortunately, more and more creative. So the acronym is progressed from just an active shooter event to an ASHE, or like I said at the beginning, an ASHE, which is active shooter hostile event response, which would be fire, police, and EMS. So that warm zone care, which is where most of the care is going to take care of you if you're injured, that's where you're probably going to receive the first care from a law enforcement or fire and EMS. The 4 ways that we are currently training in public safety to do that are, you can see on the screen, the Rescue Task Force, what's called a protected corridor, a protected island, and then last but not least, a law enforcement rescue. We'll talk more about Rescue Task Force in a minute, but let's go over real quick what a protected corridor is. In the event that you saw previously here, if that building has a hallway in it, what may happen is law enforcement may go to the junction points and secure the area so that it's more of a warm zone than a hot zone, and that will allow free movement of fire and EMS up and down that hallway to treat casualties. That is a protected corridor. If you're in, for example, your schools, you can relate to all that. If the protected island is an idea where the casualties are all brought to, let's say, the gymnasium, and law enforcement and police officers are protecting the exits so that no one can come in, that would be a protected island. And then the last event would be law enforcement rescue, which basically means fire and EMS do not enter. Law enforcement will grab you, pull you out to EMS, which is more of the older method of what it used to be done, but it is one of the options in the event. Now, I need to quickly go back to contact teams in law enforcement rescue. When you've seen those and you've watched them on videos, groups of teams, in your area, that contact team can be either usually 1 to 4 officers. So you may see 1 law enforcement person go in, you may see 4 go in. Once again, their contact is dealing with the killing as an event. So let's talk a little more about the Rescue Task Force. You can see some pictures here. This is out of California. This is a Rescue Task Force, what they will wear. So when you're seeing them on the hallway, don't be alarmed. They may or may not be identified as Rescue Task Force. The gentleman on the right has a Star of Life on there, but you can see the equipment that they carry, the bags, and the different colored tapes out there are triage tapes to tell everyone, or to tell our responders what category they're in, so we know who to take first in treatment. And you'll see from the other picture there that they carry trauma supplies to take care of circulation and bleeding, airway, and breathing as a setup. And ideally, they try to treat they have enough between the Rescue Task Force team, that has either 2 to 4 EMS personnel in it. They should have enough supplies to treat about 10 to 14 people before having to restock. Now, they will go into a zone like you saw previously, the warm zone. They'll treat the patients. They may either leave them for what's called a retrieval team, or they may be the retrieval team and take the patient back out, and another team will leapfrog with them in trying to get patients out to safety with it. So that is kind of the response. So you can see there's a lot of things going on in that with dealing with the agencies. It could be just fire and police. If you have a third service, ambulance service, it's not part of the fire department, then you've got all 3 of those. the deal. So they are training to get all of this done. Your areas may be different as to where they are at in the process on this. But the question rolls in, as we saw previously, how long does it take for someone to bleed to death? 3 to 5 minutes. And they may be there longer. So actually, how can you help in an active shooter event to make sure that your friends and other people can survive that event? So it starts before the incident. You have to be proactive. Anybody here in the audience taken Stop the Bleed training? Takes roughly about an hour and a half to 2 hours to do. So, well, good. Appreciate that. Yes. Good to know. And everybody should have Stop the Bleed training with that. If you have opportunities to participate in active shooter exercises, please do so. That will give you the idea of what should happen during an event, so that when it occurs, you've got a little bit of muscle memory built in as what to expect on that. But even before the incident, be aware of your surroundings, be aware of your environment. It's unfortunate in today's world that we have to do this. Gone in some areas of the days of just being oblivious as to what's going on. So good. I'm glad that I mentioned on Stop the Bleed that they teach it in the first year with that. So be aware of your dangers. You've heard of the Department of Homeland Security's program says, see something, say something. Well, they also have a new option now. It's called See Something, Send Something. And we'll talk more about that in just a minute. Anytime you go into a place, anywhere you go, classroom or otherwise, take note of the 2 nearest exits. Is there more than one way out of the room in case something happens, so that you can get yourself out if you have to, because the mantra is run, hide, fight. So Stop the Bleed. There's the listing of the website to get to. Some of the quick actions that are taught during the class. For those of you that have not taken it, I highly recommend you take it, because it's not just for an active shooter hostile event. It can be used anytime, any situation with it. This came out of the Hartford consensus of talking about what we needed to do to shift trauma care earlier, as you have your 3 set up. The immediate responders, in a case in your school of an active shooter event, would be you. You would be the civilian bystander. And then fire, police, and EMS would be the professional responders. And then, of course, the hospital is the trauma professionals set up there. So really, we're talking about you here as the event, the people who are the most important in this. Because if we get there and they've lost too much blood, it's harder for the trauma professionals to potentially resuscitate them or save their lives if we can stop the bleeding earlier and maintain more of their blood in their body with it. So, do your schools have Stop the Bleed kits posted? Are they in where your AEDs are located? Do you know where they're at? Take note of that in addition to your 2 exits. We do that here at the college with part of our schools. For events we do with each of our classes, we have scavenger hunts where they're supposed to find the exits, find various things, and identify where they're at as a activity to make sure that they know what to do and where to go in case of an emergency on that. So you may see these in there. How many of you all have seen bleeding control kits in your schools, or even at airports or malls? They're starting to spread out. In our area here in central Georgia, we have had a very large drive to do this, and we have put Stop the Bleed kits in every school in our area, and we've trained the faculty, and we have trained bus drivers. They're on the buses for the students. We're in the process here at our college of implementing it here and putting our Stop the Bleed kits in our AED cabinets and getting everyone trained and up to speed. Because it's not nowadays, unfortunately, it's not a question of if it will happen, it's a question of when it will happen. So I talked earlier about that see something, say something, and the see something, send something. In Georgia, and this is an app that's across the United States, the Department of Homeland Security initiative, that you can, an app for your phone that if you see something suspicious, you can take a photo of it, send a note. And in Georgia, it goes to a central intelligence center that will look at it and spread it out to the appropriate police agency to do further investigation, or in some cases even respond. as a rule. And you'll see some of the screens here, the screen on the right there, it gives you information on what you need to be looking for and how to do things with it. So those here right now are some QR codes. You've got an Android or you've got an Apple phone where you can get to that app and download it. So I'll leave that up on the screen there. If you look closer, the image on the right is what it looks like on your screen when you get it on your phone. So something very good to have with you, because if you look at most of events that have occurred, when you look retrospectively back at it, there were flags that were out there that people looking back said, oh yeah, I guess I could have seen that was going to happen. So what could I have done? Well, we've now got some other things in place to set some of those to help it better and make it hopefully prevent an incident. And some of these intels have done that. They have prevented incidents. We just don't widely publicize the misses that occur on that. So how about during the incident? You're in your school right now or wherever you're at and you hear gunfire. The mantra is run, hide, fight. Another one that you may hear is avoid, deny, defend. And the third one, since we in public safety love acronyms, is ALICE, which stands for alert, lockdown, inform, counter, and evacuate. So any one of those, depending on whichever one you want to use, will determine. Running, I'm getting out of there as fast as I can. Do I have an exit? Can I get out? Can I leave and go and get away? If I can't, hide, shut the lights out, stay away from the windows and doors so he doesn't know, lock the doors, setting up. In last case scenario, fight. Do whatever you can do to throw at them, whatever in there. And once again, dialing 911 only when it's safe to do so. Don't stand, as crazy it may sound, stand in the hallway with gunfire going on and dial 911 to say you're hearing gunshots, because he may come around the corner and you may wind up, unfortunately, being the next victim for it. So 911's been called by multiple people. They've heard the gunshots. Law enforcement arrives. Remember, the first group that comes in is going to be what we call the contact or rapid reaction team. Their mission is to find the shooter. So that's their job. If you're there and they come and they break in your room or you're out in the hallway, first step is in green there. Remain as calm as possible and follow their instructions. If you've got anything in your hands, put them down. Okay, because law enforcement is going to be on edge. They're going to be looking for a shooter, so we don't want anything in there that may remotely look like that. If you got a bag or a jacket, just leave it where it's at and go on. Next step, like they said, is raise your hands and spread your fingers. That shows the law enforcement that you are not armed in any way, shape, or form. Keep them always visible. Don't do any quick movements and follow their directions. Do not stop to ask the officers or direction, for help or direction when you're doing, because once again, their job is to do that. They will direct you how to get out, go out the way they came in. Be prepared on the outside that you may be stopped by law enforcement and directed over to a certain area. And the only reasons for some of that now is the fact that in some cases, the shooter has dropped the weapon and gone into to be apparent victim of this. So the gentleman in Marjorie Stoneman walked out with fellow students. So they may corral you into a different safe area to check some things to make sure. And they want to make sure that you're safe in the mix with that. Now, it's safe. It's good to dial 911. Here's the information that we need. Where's a shooter? If it's a building, you're not sure particularly in the building, let us know which building it is on your campus. If you know it's multiple floors and you know what floor it was that you were on, let them know that. It better pinpoints response. If you've seen more than one or hear more than one set of gunshots, let them know. If you saw the shooter, give them the best physical description. If you notice multiple weapons, because historically they use handguns, but they may carry multiple weapons in the situation. And then if you have on your way out and get to the safe zone, there were victims in various locations, let us know. That helps the unified command that sets up outside when we're starting to send rescue task forces in to various locations of where they can go within the building, if you know that. Now, we're saying don't stop and record all of this. If you know it, let us know with the response on that. So here are some resources that you can use to develop. A lot of this stuff came from those resources as a response. Like I said, that the last bullet there from the FBI, that is a report that just came out. It was published on June 1st. So the most up-to-date data on there, and it's some very good information for you on that. With that, there's my contact info, my email address. Be more than happy to take any questions from anyone right now on this. Any ways that we can help you. Send them in chat or however our host will let us rock them. Nobody be shy. If you got something you want to ask, we're more than happy. Now's the good time to do it. I currently, my full-time job, the question in there in the chat is, I see your picture, what's your role in all of this? My current position and full-time job, Monday through Friday, is I'm a program chair for paramedic technology at a technical college, and I'm the paramedic educator. So I teach paramedicine, future paramedics. My other job that I do, and that which I volunteer with our county sheriff's office, is in that picture, is I am one of their SWAT or tactical medics. I'm on their team as a response. So in an incident such as this, it normally takes a SWAT unit to get on scene and form up about possibly 20 minutes. So as you saw from the previous slides, when we go in, we're going to be a little bit later, but I will go in with the team and treat casualties. And in the Marjorie Stoneman incident, there were a few that did that. There were tactical medics in the building that did put tourniquets on and did do other treatment that saved a few lives. Now, one of the questions in here, if you feel like our school is lacking emergency preparedness, what can we do as students? First thing is contact your leadership, contact your principal, contact your teacher, instructor. Let them know about these things. Have we considered implementing stop the bleed kits? What is the school's response to an active shooter? How do I respond as a student? With what is the school's plan? For me, how should I respond? Is there a certain place I need to go? Is there a central meeting area off the school ground so that we can take a roll and make sure we've accounted for everyone? These are questions that need to be asked. And in some cases that needs to be done by the student. So on that, which job has higher rate of satisfaction in your career choice? EMT or paramedic? I will tell you, as a paramedic, I've been a paramedic for, oh, good Lord, going on 38 years. I enjoy it. EMT or paramedic, it all depends on what your level that you want to do. EMT, their skills, good basic life support. Paramedic is more of advanced life support as a setup, but all good advanced life support is predicated on good basic life support. So it's whatever you fit. Our students will start out as EMTs. They may want to become a paramedic later on, or they go straight through to become a paramedic because that's what they want to do. We tell our students as EMTs, an EMT can save lives. Things that you do wrong, you can hurt somebody, possibly not kill them, but as a paramedic, due to the medications, other things that you can do, if you don't do things correctly, you can kill somebody. Not in addition to saving life, you can kill somebody with it. So there's different setups. It's whatever you want to do. If you get bitten by the bug, start out with EMT, see what it's like. Work on, move up to becoming a paramedic. The difference in choices for our college here, EMT lasts a semester, a little over a semester, and then move on to paramedic, which lasts 4 semesters. The answer to your next question is, do EMTs have a role in ASHE? The answer is yes, they do have a role. If your area doesn't have, let's say, all paramedics, the rescue task force may be comprised of EMTs. And in most areas, firefighters are also EMTs. So all of that plays into the mix with that on that. Let's see, would medical professionals on the scene like firefighters, EMT, let us help with patient wounds if we have the necessary skills, say so, for say high school BL certified? I will tell you that if I'm in an active shooter incident and I'm going into an area, and once again, you're already doing the treatments for me as a setup, I'm going to let you continue those. Outside, when we get into the major triage areas, that's going to probably not be the case. But the concern is inside the zone. If I walk into a room and there's 5 or 6 casualties, and I can work on 1 or 2, and you've already got the skills and you know how to do that, and you're doing it, and you were doing it when I got there, I'm going to allow you to continue, and I may have you help me maintain some of those. Excuse me, depending upon how the process works. If I'm a pure rescue task force and I don't retrieve, then I may do everything here, give you the equipment, tell you what you need to do because you're doing a good job, and then I may move to the next room. So to work on. And for right now, you're talking about warm, hot, or cold zones for EMTs. Predominantly, EMS and fire is going to work in the warm and cold zone. It used to be historically we only worked in the cold zone, and that was sad. If you go back and do some research on Columbine, for example, the Columbine shooting incident at the high school, there were fire and EMS standing on the sides outside in colder zones waiting for patients. Nothing would happen. They had to wait till everyone was brought out to them as an instance. So we won't really go into a hot zone. We'll go more often go into a warm or cold zone. Your SWAT or tactical medics will probably be closer to the hot zone because they'll go in with a team and work with them on that. Because our job is, our priorities as a SWAT or tactical medic is to take care of the team first, victims next, perpetrator third. So question comes out, do EMTs, paramedics have to take extra years of school to be engaged in ASHE? The answer is no. Rescue task force type training is usually done in 2 days, and then you practice it as a setup and continue to practice until you fine tune your skills. So it's not a separate certification or skill. It's part of the skill set. We just take time to focus on it and make sure we do it right. As that on there. Any other good questions? Those were all great questions. Okay. How many years of school are, I'm assuming you're asking for EMT and paramedic? EMT lasts for us in our process. You have to go EMT, advanced EMT, and then become a paramedic. The EMT, advanced EMT process takes 12 months to complete. And then paramedic, you move on to paramedic. Paramedic takes another 16 months to do. So you're looking at going in from nothing to becoming a paramedic, also counting your academic core, which is your math, your English, your psych, all of the other classes to do that. You're roughly looking at about 2.5 years because you can do some of your academic core while you're doing your EMT and advanced EMT. So, and it's very rewarding. It's not for everybody, but like I said, it's very rewarding to save a life and bring a life in, help with a childbirth. So. All right. Well, if there are not any other questions, I want to thank you for taking time out of your day to listen to the presentation, and hope you take some of this back and work it and get it in your schools if it's not there. You all take care and you have a good day, okay? Enjoy the rest of the conference.